My next guest is no stranger to international coordination, investment, and innovation. He's all about that. Three elements are central to this discussion. Adam Boehler is the CEO of the U.S. International Development Finance Corporation, otherwise known as America's Development Bank. Prior to that, he served as director of the Innovation Center at the U.S. Department of Health and Human Services. Adam, it's great to see you again, and I really appreciate you coming in because, we were just talking to Senator Murphy and said, hey, we need a plan, we need to onshore, we need to bring in and get control of this. If there's one part of government that has the capacity to do that, it's yours. So can you share with us your strategic map of how you're thinking about what America has to do with its supply chain and its health network dependencies, if you will?
Yeah, absolutely. So one of the, I think, lessons so far in the midst of this pandemic is that the United States really needs to have, in some cases, domestic capability, and in some cases, a whole bunch of redundance across the allies. And so there was a discussion, and this goes back a few months right in the midst of this, because we saw areas of concern, and there was a discussion with Department of Defense, where they knew they have the ability to do what DF does around the world. I mean, we focus on emerging countries to drive development and then U.S. foreign policy. And so DOD said, look, these are issues that we know. HHS was noting the same thing. And he said, you guys, in essence, as you described, you're a development bank. So that's what we look like. We look like a bank, very similar to it with a real development veneer around it. And so they said, we don't really do loans. And DFC has the advantage of two things. One is massive expertise in doing exactly that. And then the second is the fact that we are an international agency is important too, because we're able to look across the world and say, hey, it may make sense to put this, some of this in the United States or invest in that, but not everything, right? Because redundancy can be just as important with allies, as I said in the beginning. So let me give you a few areas we've been looking at and examples. One is when we look at these areas where we have an interagency team, it includes DOD, state, HHS if healthcare related. And the first thing that Secretary Azar at HHS mentioned was generic pharmaceuticals. And so, he obviously indicated if we're always reliant on other countries in 90% of the drugs that we take, you could end up in a huge situation, whether intended and nefarious or whether not intended and nefarious. So that was a key one that HHS identified that DOD also was interested in. Another example, just a slight example that I'd use is we ramped up ventilator capability very quickly, and it saved lives in the United States. It also helped us to help our allies. So there is another example where if we hadn't had the domestic manufacturing capability, where would we be? Luckily, we had it on the ventilator side, and so we were able to pick it up. But we've looked at other things like, for instance, gloves. I mean, 80% of rubber gloves are made in Malaysia right now. Now, we have a great relationship with Malaysia, but what if Malaysia ran into a huge issue, massive expansion of COVID, and those factories shut down? Those are the kind of areas we want to look at because we want to make sure that always Americans are secure and safe, whether it's PPE, whether it's generic pharmaceuticals.
Adam, are you now, as you sit and look at this, and I really appreciate the outline you gave for how you were looking and reacting to the pandemic when it was hitting, but now we're going to need, I would imagine hundreds of millions, if not billions of vials of, all of the equipment that surrounds vaccines. It's actually, the physical holding, injecting, transporting stuff. And again, I'm just wondering, have you pre-positioned some of your thinking in anticipation of the kind of global vaccination requirements we're going to have?
So the way I'd separate out DFC versus Operation Warp Speed is DFC is kind of investing in the medium to long term, right? Because it takes us a little while. So if we're thinking about, let's say, onshoring generic pharmaceutical manufacturing, that won't happen tomorrow. It'll happen over a period of time. Operation Warp Speed is focused on the immediate, and that's where it's the partnership between DOD and HHS. I do know that they are working 24/7 to manufacture and be ready. In fact, I was just hearing about a facility that McKesson runs, whose job is to take all of and package all of the specific ingredients that you need beyond the vaccine, whether that's needles, vials, et cetera. So I know that, and DOD is leading on the sourcing there, and I know they're pushing very hard. And then also thinking about distribution of the vaccines themselves, because a lot of times you need refrigeration, et cetera. So they're not easy things, but I think in combination with our private market and then what DOD will do on that side, they're focused heavily on it.
Adam, let me show you the same chart that I showed Senator Murphy and it basically has a rough picture of API production around the world. China's got in this by last year, 2019, about 13% of that production. The U.S. 28%, the rest of the world 59%. Now I know that a lot of API production in the U.S. has shifted to China and India, but what should that map look like? What should be our goal when it comes to thinking about what we would feel safe and what we can trust and what you're going to need to finance, whether it's with trusted allies or in the United States? What do we need that map to look like?
And just as an aside, right, that's just APIs. That doesn't include your KSMs, right?
Right.
And I assume if you showed that chart with KSMs, you're going to see the United States go really, really low in terms of your key starting material. So, I mean, I think, I don't know that we have a specific number because I think it depends a little bit on which pharmaceutical, et cetera. But I do think that you should see a significant shift to the United States or to critical allies, particularly in the region, right? So you could see some in Western Hemisphere countries as well, and then you have redundancy. And I think, one of the interesting things about manufacturing, you think when it all moved to China back a while back, labor was more of an arbitrage than it is today, which isn't to say that Chinese labor isn't cheap. But I think that manufacturing technology has also improved massively. So your efficiency and the U.S. lead in manufacturing technology can help bridge some of that gap. And so where DFC has been focused on it is, where are areas where, because if you're going to take anything that you have in China or anywhere else and move it somewhere, there's going to be a particular cost associated with that. And so number one, how can we help in terms of that cost? And then how can we work with states, the federal government, municipalities to make the cost advantage not a huge cost advantage. So how do we, or other agencies of government in terms of how to identify this being a sustainable thing that doesn't go away after a period of a loan or something like that, because that's important to us. I mean, at the end of the day, if you think about what DFC does across the world, what we drive is we drive U.S. policy, whether that's development, whether that's bringing things on shore to ensure that Americans are safe. But we invest in sustainable solutions. And I think that's important. One of the nice things about DFC is that we return money to the American taxpayer, right? We reduce the deficit. But beyond reducing the deficit, I think it's very important when you have sustainability because things stick. And so that's been the most important. And so, I think you'll see more shift because it's a huge policy. We are a component of that, but it's a whole of government approach, working with also states and municipalities.
Adam, I don't know if this is something you can talk about, but I would love to just give our viewers a quick snapshot of the international work you do. You've mentioned it a few times, and the fact that you're doing this, because right now, if you look at the kind of, what I would say, surface noise out there, the international system looks troubled, trust looks complicated, but beneath it, there are these working functionalities that sometimes people don't see. So I'd love to kind of understand, and maybe get a feel for your, international coordination. Is it where it needs to be? Is it healthy? Do you feel it's solid?
Yeah, absolutely. So I'll give you a quick background on us and then what we do. So DFC is a relatively new agency. We used to be called OPIC, O-P-I-C. Sure. So it was confusing. I always thought it was the oil
Overseas Private Investment Corporation. Bad name.
Yeah, that's right. That's right. So that we got rid of that confusing. I didn't have to open every meeting with that were not the oil consortia. But I will say, so Congress passed something called the Build Act, and Senator Murphy, who was just on before, was heavily involved in that. And one of the best things about this policy is that Congress recognized that you have a huge win for the United States. And here's what I mean internationally, which is we invest in developing countries to promote our foreign policy and American values, and we make money for the taxpayer. And so what was happening, and this is what the senator was referring to a little bit, is you obviously have China that is investing over $1 trillion in their Belt and Road Initiative. And, you know, what they focus on is undo Chinese influence. That's their goal. We tried that 200 years ago. It was called colonialism. It doesn't work very well. So how do we approach it, and how is DFC different? Is because of this new agency, we're able to say we are the alternative to autocratic, you know, closed, non-transparent investments. And I will tell you, at a meeting, and I've met dozens of heads of state in my role traveling to developing countries, and I would say 100% of the time, what they say is, we didn't want to take that money from China or Russia or wherever. We wanted an American alternative, but there was none, and I'm able to be that alternative. And so we are now a $60 billion, we're kind of the money of the U.S. government in a way, with some other partners, but we are the development bank of the United States, and the flexibility that was given to us, bipartisan by Congress. I mean, the wonderful thing about this is not a Republican ideal, it's not a Democratic ideal, it's an American approach. I was confirmed voice vote by the entire Senate, and that meant a lot to me because these are shared values in what we do.
Right, I mean, I think it's great. We're taking questions from the audience, and we have one for you from Daniel. Daniel?
Hi, this is Daniel Faraci, CEO of Grassroots Political Consulting in Washington, D.C. My question for you is, are there programs other than BARDA that are available to identify domestic manufacturing capability?
Sure.
And is it you?
Yes, I am a program besides BARDA. So I'll divide up a few areas. One, so you know, is that you have BARDA that is making investments. The NIH is making investments on lab testing manufacturing. So they have a separate, Congress gave them a separate power to do that. DOD makes purchases if it has to do with manufacturing for national security. They have the ability to guarantee purchases and make purchases. And then think about our domestic authority is really making loans and investments to support manufacturing, as long as they're to ensure the safety and security of the American people in the context of a pandemic. So that's where we're going to focus. And you can often see folks working together. We do a lot with HHS, with BARDA. So, you know, BARDA could say, we want to make an initial investment, but we're also going to pair this with manufacturing authority. So we can work together, and sometimes we can serve as a concierge there. We're happy, if it is relevant to us, to sit down and say, hey, this is what makes sense. And by the way, if there's private market capital we can identify, we'll move out of the way too, which is a great outcome. So our job on this, if we see an opportunity and it fits and it makes a difference for the American people, is to try to figure out if there is a way to move it forward. And if that is DFC as a part, that's fantastic. If it's us just helping, that's fantastic too.
Well, Adam Boehler, CEO of the U.S. International Development Finance Corporation, has been part of my favorite, one of my favorite discussions here. I learned a lot. I'm glad you're there doing what you're doing. Thank you so much.
Thank you so much for having me on. I appreciate it.